Diabetes represents an expanding health crisis worldwide. How can we effectively manage this condition? This video aims to enhance your knowledge of diabetes management. Our objective is to provide you with crucial insights into diabetes treatments. Let's begin by examining the different types of insulin. Insulin plays a vital role in diabetes management. Individuals with type 1 diabetes require insulin since their bodies cannot produce it. Traditionally, insulin was sourced from animals, but now advanced technology generates human insulin. Next, we'll delve into the clinical applications of insulin. It mainly treats type 1 diabetes, yet it can also benefit type 2 diabetes when other treatments are ineffective. Insulin facilitates increased glucose absorption by muscles, supporting essential processes such as glycogenesis and lipogenesis. Now let's address contemporary treatment trends. Recent studies emphasize personalized medicine's importance. There's a growing preference for combination therapies that enhance efficacy. This strategy also helps reduce side effects. Now we must consider the potential adverse effects of insulin. Allergic reactions can occasionally occur from insulin therapy. Another concern is hypoglycemia, which poses significant risks. Educating patients is crucial to effectively mitigate these risks. A solid understanding of pharmacokinetics is essential. Different insulin formulations can optimize treatment. Ultra-rapid and rapid-acting insulins, such as insulin aspart, act quickly and provide immediate glucose regulation. For sustained control, we utilize intermediate and long-acting insulins. These help maintain stable blood glucose levels throughout the day. Now let's examine the routes of administration. Insulin can be delivered either intravenously or subcutaneously. Proper administration is vital to ensure effective therapy. Finally, let's discuss oral hypoglycemic agents, crucial for managing type 2 diabetes. Secretagogues promote insulin secretion but can increase hypoglycemia risk. Next, we consider sensitizers including metformin. These enhance insulin sensitivity and assist in glucose level management. Gastrointestinal glucose absorption inhibitors, such as akerbose, minimize glucose absorption after meals. In conclusion, managing diabetes demands a comprehensive approach. Understanding insulin's role and other medications is crucial. Stay updated on the latest treatment strategies to ensure optimal patient care. Now, I encourage you to implement what you've learned today. Understanding diabetes management can greatly enhance patient outcomes. Subscribe to the channel and click the bell to get notifications. Thank you for your attention.